All right. Hi guys, this is Dr. Bhupesh once again for you, and after a long time we are going to record a session of reading. So I've already asked you which questions you want to cover. It's question number 1, 3, 5 and 6. So suppose you are sitting in the exam, how do you go about the momentum of the test? And in the part B, please spend only 10 minutes, not more than 10 minutes. If you can solve 4 questions out of 10, you are doing very well in your OET exam. Then jump onto the part C. Again, try to find easy 5 questions out of 8. Then in the part C, second, again try to find 5 easy questions. 5 plus 5 plus 4 will make 14 and you will pass. Don't think you can do all the 6 questions. If you are brilliant scoring about A, then it's a different part. But still, even the people who are scoring A, they must be leaving some difficult questions as well in the start. All right. First, the purpose. Purpose wala questions, as I always say, is very important and it's different as well. It's not difficult. It's different. You have to think less when it comes to purpose wala questions. Last line is the most important line, as I always say for the purpose, and first line is the second most line important line, because first and last line tells you what is the topic. So let's read the topic. The purpose of the memo is to, or department physicians, aseptic technique. Obviously they have already given what is the purpose. Subject is also purpose na, aseptic technique. Aseptic technique protects the patients during the invasive clinical procedures by employing infection control measures that minimize as far as practicably possible. So as far as practically possible, they minimize the infection, the presence of pathogenic organisms. So they are basically aseptic techniques. They are giving the definition that they protect the patients from any invasive clinical procedures. Good aseptic techniques procedures help prevent and control healthcare associated infection and must be preserved. So now they are talking about, first they were telling what do aseptic techniques do, what is the benefit. Then they were telling about that they will also, so I think they are talking about the benefits. As you are aware, the aim of every procedure should be to maintain asepsis at all the times by protecting the key parts and key sites from the content contamination by the microorganism. So now they are again talking about aseptic techniques. This can be achieved. Now the topic is changing, because earlier they were talking about the benefits, that it will keep the organisms away, and they were talking about they it will control healthcare infections and all that stuff. But now they have started talking, sorry I forgot to mute the mobile phone. Okay, yeah. And this can be achieved. Now they are talking about how this can be achieved. This can be achieved through correct hand hygiene, a known touch technique, glove use, ensuring asepsis, and sterility of equipment. While the principles of aseptic technique remain constant for all the procedures, the level of practice will change dependent upon a standard risk assessment. So they are saying principles will remain the same, but the level of practice, that how much precaution you will take, will depend on the standard risk assessment. So now it's a weird topic. Provide staff information about appropriate methods. It can be, but again I'm confused whether to do this thing or not, because I don't know what are the appropriate methods. So that is the only problem I am facing in this, that I haven't got any appropriate method. Okay. Notify the staff of a possible change. I cannot see any change. This is the word I would love to eliminate. Now my chances of correcting it was, please understand the technique, 33%. A, B, C, three options. That means 33% if I am confused. But if I can eliminate one option, change word, then my chances of getting this question right is 50%. Either A or C, 50-50. So 50%. That is how I improve my chances. Provide staff the information on appropriate methods, but I cannot see any methods, to be honest. Can we see any methods like sterilization? Yeah, this can be achieved through correct. Only one line is given, non-touch technique. This is the method. That is the only method given. Otherwise, they are not talking about anything. Then they are talking about possible change. No, remind the staff of the importance of following best practice. This can be the message, because ultimately they are talking about aseptic. They are reminding the staff that you need to follow. What is the importance? It will prevent infections. That is the importance. And in the last also, they have talked about microorganisms and then they have talked how. So overall, I am confused between A and C, but C seems to be a better option because they are reminding the staff that it is important for you to minimize the infections. Again, in exam, I cannot devote more time to this question. That is the only thing you need to do. Even if you think A, do A, but learn elimination method. It answer still can be A, but as per me, I am eliminating this word appropriate methods. So there are no appropriate methods which are given. They are just telling the staff of following the best practice, that is to prevent the infection. So this, what I think is the answer should be C. But again, don't waste time. Let's go further. That is what is the saving of time when it comes to reading. Because now, no matter how many times you read, you know every line, you know every option. Why to read again and again? It can be wrong, that's fine. But don't waste your time in the first round when you are doing 4 questions. You can leave this question as well. But again, you have told me that second question is easy. That is why we are not doing it. So I'm doing question number 3. Let's see what is important in question number 3. The guidelines specify that those performing an MRI, the people, those means living things, those performing an MRI, the people who are performing an MRI on the patients with implants or foreign bodies. So what is the question? Again, make question very clear in your head that the guidelines specify the people who are taking MRI with MRI bodies, what with implants, what should they do? Suppose if somebody is having dental implant or any kind of implants, what is the thing that people have to consider who are taking MRI? Guidelines for the management of implants and implantable devices or other foreign bodies may contraindicate MRI scanning or cause significant image artifacts. Obviously, if there would be any pendant, then I will not be able to take the X-ray. That is why I remove the pendant. There is a growing number of medical devices and implants that are classified as MRI conditional, placing the responsibility for the safety on the operator. So operator has the safety. Operator has to, and this is the word for operator only. So the guidelines specify that the operator performing an MRI. Okay. It should be stressed that safety at a defined field strength or for a specific MRI is no guarantee safety at a higher field strength or a different MRI system at a different. I don't understand this line, heavy line. I will not read it too much. If there is any doubt as to the nature of the device, then a scan should only proceed after a careful assessment of the potential risk and benefits of the scan with the device in situ. This is the line that if there is any doubt, then if there is any doubt, then a scan should only be processed after a careful assessment of the potential risk and benefits of the scan with the device in situ. The MRI safety expert can assist with identifying and quantify the risk, but the decision to scan is a clinical one. So in the last, what they have said is ultimately the decision is a clinical one. Clinical means यहाँ पे over here clinical means practical, that the MRI safety expert can assist, identify, and quantify the risk. But so there is again a weird topic talking about the MRI. Earlier they were talking about easy things that you have to remove them, but then they started talking about different wavelength and all that stuff. In the exam, this question would be a hard question to do. If options are not easy, this is the question again we will not do in the first round. But first question could have been done. This question I find more difficult. How do I find it difficult? Question was little tricky, paragraph was even more tricky. That is how I understand that I have to leave this question. Okay, the guidelines specify those performing an MRI on the patients with implants or foreign bodies should abandon the scan. Abandon means should stop the scan if unsure of the device. I don't find anything that they wanted to stop. They only said that it should proceed only after a careful assessment, but they were not talking about abandoned. So this is a very hard for me word for me. I would like to eliminate it, but again, not sure. Have the final say in whether to scan a patient. This can be the answer because ultimately in the last line they were saying decision is a clinical one, but abundant word was not given. If there is any doubt as to the nature of the device, then a scan should only proceed after a careful assessment. And this is saying only word is also given, should abandon the scan. If unsure, this can also be the answer because they are saying scan should only proceed. Scan should only proceed after the risk and assessment. So that means they can stop the scan if they are unsure of the device. And if they are unsure, only after the careful assessment, they will again do it. So A can be the answer as well. And B can be the answer due to the last line, have the final say in whether to scan a patient or not. They have the final say because it is the clinical one. So as far as I think A and B, again, I am confused, but A seems to be a better answer the way I am reading at the moment, because only word is given. Only word means if there is any doubt as to the nature of device, then a scan should only proceed after that. Means if they are unsure, that means if they are not sure, they should not do the scan. A seems like a better option for now. But again, no wastage of time. Just carry on with the flow. Okay. Question number 5th. The nature of the indwelling catheters provide information about the notice on the indwelling catheter. So they are talking about the catheter. They are talking about what information does it provide. Okay. Indwelling catheter or the urinary catheters. Sorry, just a second. Yeah. Indwelling urinary catheters. Let's read the topic. Urethral, prostate, or the bladder neck injury resulting in the false tracts, strictures, and bleeding are related to traumatic urethral insertion. So when you are doing traumatic, means wrong urethral insertion, then obviously these injuries will happen. Traumatic injury. So they're talking about traumatic injury right at now. When they're talking about catheters, they are talking about traumatic insertion. Traumatic injury is less likely to occur with appropriate catheter selection, lubrication, correct patient positioning, and insertion into the full bladder. So now they are talking about that it can be prevented. So again, they are talking about traumatic injury as the main topic, that it can be avoided. Traumatic injury can be avoided by these methods. Retention balloon should not be inflated inside the bladder, which is indicated by the urine return. It should only be inflated inside the bladder. So the balloon should be inflated only when they are inside the bladder, which is indicated by the urine return with IUC inserted to the head. This is an extra word. I won't overread it, but I can understand this line. They are talking that the inflation of the balloon should happen when there is correct positioning in the bladder. If there is any uncertainty, that means if you are not sure, if you are confused regarding catheter placement, balloon should not be inflated. So again, they are saying if you will inflate the balloon and you are not sure, it will cause traumatic injury. If the patient experiences pain with inflation, then again deflate the balloon immediately and reassess IUC position. If the patient is having pain, that means again the insertion is wrong. So overall, if you can understand, the topic is about traumatic injuries. And the topic is talking about deflating balloons, putting it at the right position. So it's talking about how to prevent the traumatic injury. Indwelling urinary catheters should only be used with caution in the patients at the risk of self extraction. So when the patients who can self extract, then it should be used with caution, such as those with dementia or delirium. They can do the extraction themselves, self extraction. That is where you need to be aware. When available, ultrasonography is recommended to evaluate bladder volumes and guide SPC. So overall, they are talking about how to insert the catheter in the right way and how to prevent the injuries due to catheter insertion. The order for the correct insertion word is given. It is a very good word, but the order has not been given. That first you should do this. Order means step 1, step 2, step 3. I am not given any steps. Yes, they are talking about correct insertion, but overall the topic was not about correct insertion. The topic was about traumatic injury. Traumatic injury is less likely to occur by these things if you are inserting deflate the balloon. So they were talking about how to prevent the traumatic injury as the main topic, and they were also talking about the correct insertion, but steps order was not given. Optimal positioning of the patient. Sorry, if that would have been the optimal positioning of the catheter, I would have taken it as a choice. that they were talking about optimal positioning of the balloon of the catheter, but they were not talking about optimal positioning of the patient. Super eliminated. How best to avoid harming the patients? Yes, the topic was all about how to avoid harm by doing the right insertion, by doing this, deflating, then it should be used, then ultrasonic is used. So obviously they were talking about how to prevent the traumatic injury. A option could have been the matter of choice if order word would not have been good. The order for correct insertion, but I have not been given any order. Order means step 1, step 2, step 3. So that was not given. So this answer seems to be C. And it is best answer as well. Then the last question. In the last question, you have to change the answer. It has to be B because you must have done C, guys. But again, they were saying the question is about delirium. Delirium and dementia commonly coexist. However, the later means dementia. Later, there is much slower deterioration in the thinking, perceiving, and inattention is much less. But delirium is usually due to an interaction between the multiple D. Management should be aimed. I will read it, otherwise it will go crazy. Okay. So they are asking that extract from a handbook says that patients with delirium experience. So what happens with the patient with delirium is an acute deterioration, acute, fast. Acute means fast. Cognition often with altered arousal, this and psychotic features. The main cognitive deficit in delirium is inattention. That is, the patient is distractible and cannot consistently follow commands and loses the thread during a verbal. So in the delirium, the main problem is that patient is inattentive. He loses his focus, distractible. That means he can be distracted. And then delirium and dementia, they commonly coexist. They occur together. However, the later is much slower. It is acute. Delirium is acute. Later means dementia. Delirium, if there are two words, delirium and dementia. Delirium is former and dementia is later. So I have been given this later word, LATTR. Later means second one, dementia. So dementia is slower. This inattention is much less prominent. In this, inattention is not a problem. In this delirium, inattention is the problem. Unable to concentrate, distractible, cannot consistently follow commands, loses the thread. These are the delirium. And my question is about delirium. So delirium is acute, fast, and all this because delirium is usually due to an interaction between the multiple predisposing factors. So there are multiple factors which are responsible. Management should be aimed at not just finding and treating the assumed cause. So you cannot treat one cause because it is due to multiple factors, but also optimizing all the aspects of the care. So to treat the delirium, you have to cure all the aspects. You can't cure one cause. So the extract from a handbook says that patient have a similar cognitive decline. No, do not have similar because in dementia it is chronic, in delirium it is acute. So this line does not go. 100% elimination. A loss of interest during conversation. Yes, he loses the thread. Uh, the extract of saying that patient with influences delirium experience influences that may trigger the disorder. This line is not given right. I know the answer is given C, but the answer should be B in this case because C is not making any sense. The extract from a handbook says that patient with the delirium experience influences that may trigger the disorder. I cannot understand this point, so I will go with B. So these are overall questions of part B. Again, don't waste time. In exam, it can happen as well. We are sure about no answer. I understand. But again, the average luck will work. That out of 4 questions, if you have all the questions 4 difficult, then at least 2 questions will go right. If you will not overthink. So now I will take your help and you can help me. And please mute your microphones if there is a background noise. But yes, do participate as well because I need to know the answer. Seriously, I know the answer of only question number 6, which should be changed to C. I know the question. I have done it in Chandigarh only today. Question number 5, answer is C. That was right because I did it in Chandigarh. This is also right, I know. And the reason I told was the order word only. I could easily eliminate it. So now you can tell me question number 1 and 3. Question number 1, what is the answer?
C, sir.
C.
C.
And we did C as well. All right. So appropriate methods were not given, that how to do it, how to do the aseptic. Appropriate methods means They would have talked about autoclave, something like that, but nothing was given. So C seems fine. And then this one, third question, I was really confused about A and B.
Sir, B is the answer.
B is the answer. Sure about it?
Yes, sir.
Yeah, maybe they would have taken the last line that it was given MRI safety. Last line, I was confused. The MRI safety expert can assist with identifying, but the decision to scan is a clinical one. That means it is a practical one. So, what they have the final say in whether? So, the people who are performing the MRI have the final say in whether to scan a patient or not. So that can also be the answer. But this also seemed like an answer that should abandon the scan. But again, abandon word was not given. I was confused, but I said abandon can be stopped, and they told that we should not do the scan until we are sure. So that's fine. A or B, but B also is right, to be honest. I could not put the elimination method. But again, if you can understand, out of the four questions, three are right. But the major thing I have saved is time. Time is the most precious thing when it comes to reading. So if you can do 3 out of 4, you are all good to pass. This is the main strategy. Please subscribe our channel if you have not. And follow us for the right guidance. This is Dr. Bhupesh from Dr. BKM OET Institutes. Our contact number is 76967 34256 for the best OET coaching. Thank you.